And I wonder if you have any thoughts or ideas of maybe like techniques a person could do with themselves, like manual hands-on kind of techniques, or maybe places within the ribs or the diaphragm or the neck or the clavicle or the nasal passages or any of that, or the pelvic floor, that would actually just naturally, organically end up causing the breath to be regulated into a more healthy, homeostatic state through actual like manual intervention?
Yeah, that's a great question. And I agree with you there. But the beautiful thing is when you start to watch your breathing and you try to pay more attention to the longer exhales than the inhales, you'll physiologically change your body and you will automatically decrease tension everywhere. And the reason that's happening is because you're going to be out of fight or flight more often and more towards the parasympathetic system, where you can chill.
It almost like softens the clay in a way of the nervous system. Like if you were hypertonic, you can start to become more, a healthy tone of your connective tissue through the breath. And then from there, it opens up the space to create structural change. Is that right?
Yeah, and that's a great phrase too, because it actually physiologically does open up space.
Yeah.
Because when you're tense, you close space. And when you open up space, everything can relax. And then people always ask me what relaxes in the body. And my answer is yes, everything. Muscle, fascia, ligament, viscera, eyeballs. I mean, you name it, right? It all relaxes down.
It's like opens you to love.
Yeah, it is hard to love when you're in fight or flight.
Bound up.
Because the reason being is it's hard to love anything when you're dead, because you got to not die first.
Yeah.
But let's say that the thoracic diaphragm, for instance, that's underneath the rib cage here and below the lungs and sits above your abdominal organs. All right. That's a muscle. And you need to remember that. And muscles get really, really tense and tight when you're in sympathetic dominance, including that one. And if you have any inflammation around the organs of your body, which if you have chronic pain and an autoimmune disease, I already know the answer. It's yes, they do. And when they're inflamed, muscles around them go into what's called a muscle guarding reflex, because their job is to protect and to isolate and not have things move because there's inflammation there. Does that make sense? So, and when you can just get this basic relaxation one down, you'll start to relax your thoracic diaphragm more, which means that that muscle can physiologically now move more, which means when you inhale, especially through your nose, that tends to typically drive engagement of the diaphragm muscle more efficiently. So it contracts and it pushes down towards the floor, pushing your organs toward the pelvic diaphragm or pelvic floor, which hopefully is strong enough to catch it. Then when you exhale, then the diaphragm muscle relaxes and then it ascends, comes back up. Then the pressure in the abdomen decreases, and then now the organs ricochet back up, and then the pelvic floor ricochets back up. But when you also use your nose as opposed to your mouth, you typically have a much better cervical spine alignment, which will help the nerves in your neck and in your brain stem that supply how the diaphragm and the abdominal organs actually function. So it's a top-down approach. One is your phrenic nerve, which we can get into later. The other one is your vagus nerve that goes to the organs down there. So that actually can help things move more efficiently. But here's what I find. People are so tense and tight from the maladapted breathing. They're very shallow. So they use way too much of the neck muscles, and they use way too much of the upper trapezius, and the pectorals and the shoulders do a lot of the motion here. They don't use as much as they should down below in the abdominal region or the rib cage along the sides and along the back because you have a posterior part of the diaphragm too, with the lower part of the thoracic spine in the back. So those are really, really tense and tight. They're hunched over, typically in this kind of fetal, almost cashew nut position, because one, of sedentary posture, we sit a lot, but two, that's a natural protective response when you're in fight or flight. You curl forward for one single reason. You're trying to protect the most vulnerable structures of the body, that if a predator took them out, you would be dead quick, like your throat and your abdomen, right? One swipe, you're done, all right? So you get really, really tense and tight there. So they don't have the ability, because they just simply can't even feel it, because they're so tight, of expanding the rib cage anywhere except up. They can't feel it go out. They can't feel it go forwards and back. And they're so tight in this region. The neck is a hot mess and a half, because my people usually breathe through the mouth all day long. So they've automatically lost any stability in the cervical spine and neck, which is going to just crush their brain stem and blood flow to the brain. And they've got a lot of inflammation in the abdomen. So even if they wanted to take a nice deep breath in, or breathe with the 4 in, 6 out, they're so restricted that the body just says, physiologically, I'm having difficulty giving you your motion. Can you go in there and relieve some stuff? So that's where, in my world, I do a lot of stuff to the cervical spine for sure, to help release the tension in those accessory muscles. For those that are listening that will want to know, that's usually your sternocleidomastoid muscle and your scalene muscles. And they can cause a lot of neck pain and headaches and sinus issues when they get set off. I have to get rib cage motion in every direction, and including the sternum. The actual rib articulations on the sternum and on the thoracic spine are locked in stone. And then in the lower part of the abdomen, the fascia, connective tissue, abdominals from your oblique muscles to your transverse abdominis, if anybody cares about the anatomy, is really super tight under the margins of the rib cage there. So then it's very difficult for the diaphragm to drop, even when you do it. And what's even worse is the back part of the rib cage, where the kidneys are located, and the lower ribs there, because they have such tight, tense fascia there called the thoracolumbar fascia, from the lumbar spine to the thoracic spine. That's the fascial bridge from one shoulder to the opposite side hip that should be working well when you walk, if you're actually walking. And they're not able to move in that posterior diaphragm whatsoever. And that's where a lot of issues happen. So I will tell you, probably one of the biggest things that I neglected early in my career was looking at the role of the rib cage in general for its motion. I looked at the spine a lot, because my background is chiropractic. I mean, that was kind of my playground. But the rib cage itself is a huge player. So if you can go in there and do some releases, soft tissue releases or mobilizations, either seeing someone, or there's a lot of things you can do for yourself, and you combine that with the breathing mechanics that we talked about before, you'll typically notice a huge difference in your breathing, but you'll also notice a huge difference in how you feel virtually everywhere.